We have an apology today from this very important speaker, but we have a video message. So this is Professor Michael Kidd AO, Australia's Chief Medical Officer. Professor Michael Kidd is the CMO based at the Australian Government Department of Health, Disability and Ageing. By background, he's a general practitioner, a primary healthcare and public health researcher, a very distinguished researcher actually, and has served as President of the Royal Australian College of General Practitioners and President of the World Health Organization of Family Doctors. He's travelling due to work commitments, but has recorded a video message for us today. Hopefully that can cue now, thanks.
Hello, and thank you to Plumstone and to Amy Lewis of the Safer Air Project for inviting me to share this message with you today. I'm sorry I'm unable to be with you in person. I'm currently in South Africa, participating in the G20 Summit meeting of health ministers. I'll start by acknowledging the traditional owners of the lands where you are today, the Ngunnawal and the Ngambri peoples. I'd also like to acknowledge the presence of the Honourable Rebecca White MP, of my colleagues, Senator Michelle Ananda-Rajah, and my fellow GP, Dr. Amanda Cohn, and also Professor Lydia Moroska and Anna Maria Arabia from the Australian Academy of Science, along with other parliamentarians and distinguished guests. I've spent much of my professional life working to strengthen healthcare here in Australia and all around the world. And like you, I appreciate that the air we breathe while indoors in our public and private buildings can have a direct impact on our health. Poor indoor air quality can contribute to a wide range of health issues, including airborne infections, asthma, and exacerbation of long-term chronic health conditions. Some of these health impacts affect some people more than others, particularly children, older people, and people who are immunocompromised or living with chronic health concerns. The Australian Institute of Health and Welfare estimated back in December that in 2018, over 4,000 deaths, nearly 3% of all deaths in Australia that year, were due to air pollution. This number is nearly 4 times the national road toll. This estimate is from air pollution and does not include deaths from airborne viruses or from dust diseases like silicosis and asbestosis, which are responsible for many more. These deaths, as well as affecting individuals and their loved ones, also represent a very significant preventable burden on Australia's healthcare system. And they represent a huge economic burden and lost opportunity. Last week, the Lancet Countdown on Health and Climate Change in Oceania estimated that in 2022, the value of premature mortality due to outdoor air pollution in Australia was nearly $15 billion US. That's over 22 billion Australian dollars. The Australian Government and the Department of Health, Disability and Ageing recognise the importance of air quality to human health and well-being. We're committed to addressing the health impacts of air quality as part of environmental health, including through the work of Australia's new Centre for Disease Control. Pending the passage of legislation in the Federal Parliament, the Australian Centre for Disease Control is expected to launch on the 1st of January 2026 as an independent agency delivering trusted advice in an ever-changing public health environment. We know that both outdoor and indoor air quality are inextricably linked and have significant health impacts. Strengthening Australia's resilience and response to the health impacts of indoor air quality requires coordinated action across and between governments. As the chair of the Australian Health Protection Committee, the AHPC, I'm pleased to share that significant effort has been focused in this space already. As Minister White has mentioned, the interim Australian Centre for Disease Control is coordinating work to prioritise indoor air quality on behalf of the Environmental Health Standing Committee of the AHPC and across the Australian Government. The interim CDC is also working to provide practical public guidance on the links between health and indoor air quality. And we're also finalising further advice to assist individuals and families to learn how to keep the air inside our homes safe. The air quality inside our homes and workplaces affects every Australian every day. Clean indoor and outdoor air is crucial to our health and well-being. Thank you all for the important work that you're doing. By continuing to advance this conversation and through working together, we can reinforce the importance of clean air in ensuring better health for all people in Australia. Thank you.